Important to understand that the purpose of the fast is to really get the most spiritual benefits of fasting. In order for you to do that, you need to have a healthy physical body in order to be able to perform all the rituals and the rites and everything, the worship that goes with the month of fasting. So it's important to make sure that you eat properly because the fasts are extremely long. They're over 18 hours where the person's not eating and drinking. So with that length of a fast, it is important to make sure that that person is adequately prepared so that during the day when the person is fasting and is not eating and drinking, that they are able to sustain themselves in an appropriate way in order to even go to work, carry out their activities of daily living, but at the same time they're prepared towards the end of the fast to do all the rituals and rites and the worship that goes with the month of fasting. One of the things is that when you break your fast, you want to avoid food that is very high in sugar or really deep fried foods and foods that even fruits that are very high in sugar. These are some of the things that you want to avoid, because what you want to avoid is to have a peak in your sugar level and then it drops precipitously. And when you have those peaks and drops, they actually affect your health and they affect your body, and they may even affect your thinking and even your tiredness during the following day when you're going to fast. So what you want to do is to take foods that are going to sustain a very steady level of sugar inside of you, and that will give you enough sustenance and enough energy that will last you for the whole day, the following day. Hydration is extremely important because of the fact that we are in the summer, number one, and number two is they are long fasts, over 18 hours. So it's important to hydrate yourself when you break your fast until the time that you are beginning the following day, that your next fast. And it's important to hydrate yourself in two ways. Of course, the first and the most important is to take water, lots of water, but also to take foods that contain water, right? So foods like vegetables, like carrots and cucumbers and things like that, that actually have water content in them that will release the water slowly during the day. You know, I don't think that people with chronic illnesses necessarily need to avoid their fast. I think what is important is that they have a consultation with their family physician prior to the month of Ramadan starting. They need to really work with their physician as a team, make the physician aware of the fact that this is what they want to do, this is why they want to do it, and then ask them to work with them to be able to adjust their medications, for example, in an appropriate way. So you need to be careful in the summer as far as exercise is concerned. In an 18-hour fast, you don't want to be exercising in the middle of the day and doing intensive workouts because that could lead to further dehydration and problems related to that. But it is important to exercise during the month of Ramadan whilst you're fasting. And the best exercise that I can suggest is a light walk. And especially if you time the walk right before the person is supposed to break their fast, so that you do a light walk before you break your fast, that can have significant benefits, heart benefits, and exercise has benefits throughout the body, and it can have significant benefits for the person, medical benefits for the person. But light exercise prior to ending the fast is probably the best way to go. Intensive exercise should be avoided.